pulsed electromagnetic devices, organized in collaboration with NUAGE Health Devices Pvt Ltd.
To begin with the event, we invite Dr. Professor S.K. Khatri Sir, Additional Pro-Vice Chancellor and Dean of Academics at Amity University, Uttar Pradesh, to address this gathering. Sir's distinguished leadership and commitment. Sir, I invite you to the stage. Please join us on the dais. I also invite Dr. B.C. Das Sir and our delegates from Russia to please join us on the stage. Good afternoon, everyone. We welcome you all at AIHAS for our continuing medical education cum training workshop on pulsed electromagnetic devices. To start with the event, I invite Dr. Professor Jasubanta Sethi Sir for the welcome address.
With blessings of the Almighty, as well as our most honorable Honorable President Sir, Dr. Ashok Chauhan, Honorable Chancellor, Dr. Atul Chauhan, Honorable Vice Chancellor, Dr. Balvinder Shukla, and over here, Dr. S.K. Khatri, the Additional Pro Vice Chancellor and Dean Academics, Dr. B.C. Das, the Dean Health and Allied Sciences, with all our Russian guests, we just take the opportunity to be the part of continuing medical education, come training workshop on pulse electromagnetic field therapy. So we are so honored to have our Russian guests, Dr. Olga Dodosova, who is the key person from Elamed, Russia, and she is the head medical director of Elamed, who has visited with her team in last year 2025 early January And of course, with so much blessing from Dr. Sunil Sharmaji, who is not here today, is the main key person from India, is the main owner of NUAGE Health, who had given a very blessing consent to have these Russian doctors to Amity University to see our labs and interacted with our faculty members to have the research on their instruments, and it's more auspicious today. They have come to give the CME come training workshop on few instruments today. We have Dr. Alsei Ivanov. He has visited India and Amity the second time. This is, and we are so honored. He is the advisor of Russia and vice president. But he speaks only in Russian language, doesn't understand English. But our translators are here, Miss Julia. So we are fortunate to have you, Dr. Ivanov, and he's the best researcher and some advisor in the editorial board of Physiotherapy Russia. So thank you so much coming over here to give us few demos on your new this Polymag, whatever is given today to Amity University, and especially to AIHAS. Next we have Mr. Alsei Arevo. Is the man here sitting, and he has come first time to Amity University. First time he has seen it. We are so fortunate to have him here. Miss Julie, I would request that later you could translate and tell him. And I think he understands little bit English today. He said that while receiving him. So we are so thankful, Mr. Arevo, that you are here in AIHAS and Amity University. And so, moreover, Miss Julia is there, is sitting in the front, that side, and she's a key, and this is moreover the best coordinator, and is translator. Thank you so much for accepting our invitation, coming over here. And of course, we have the man behind every show, the CEO of NUAGE India. I would request, please, Gautamji, please stand and let's have a kind of applaud. Yeah. So he is the son of our Sunil Kumar Sharma ji, who has blessed us and given this all these opportunities with Alamed. So thank you so much that all of you have come over here and given this opportunity to have the alignment in the latest equipment in the pulse electromagnetic field therapy. Of course, I am so happy to welcome our best clinicians in the field of physiotherapy are here in our Delhi NCR. Among them we have Dr. Jayaprakash. Dr. Jayaprakash is sitting here. He has got some talk also on this, and he will tell. Dr. Jayaprakash is a chief physiotherapist in Dharamsala Narayan, and he is super specialized in this neurology, and his topic of PhD research was very well accepted in Stroke Journal as the Impact of Group 5. And then we have, of course, one more, Dr. Makija, Mina Makija. So she's also here. She has also a small talk on this pain and osteoarthritis with this concern. And I am very fortunate to have all my PG students over here sitting behind, along with the clinicians here. So definitely this part of the CME will give definitely best alignment to our field of expertise, where we can just inculcate the basics and advancement of this PMF in various field of our therapy as well as research. And this will be definitely a good adjunct to existing uh, therapies in many conventional. So with this, I just thank all of you uh, for this. So God bless you all. Thank you.
Thank you so much, sir, for your inspiring and motivating words. We are now privileged to invite Professor Dr. S.K. Khatri, Additional Pro Vice Chancellor and Dean of Academics at
It is a moment of great privilege and honor to invite the cornerstone of academic leadership at AIHAS, Professor Dr. B.C. Das Sir, Dean of Health and Allied Sciences, Chairman of University Research Council, Vice President of Amity Science, Technology and Innovation Foundation, to grace us with his welcome address and set the tone for today's proceedings. Sir, we request you to come forward and share your valuable thoughts.
To speak on this occasion. So, at the outset, we seek the blessings of most respected Honorable Founder President Dr. Ashok Chauhan, who is the founder of, the creator of this committee education group. So, 13 universities in the country, and there are more than 17 the campuses abroad, including US, UK, and several places. So, and we have more than 2.5 lakhs, which is how many million students, and 7 lakhs or 8 lakhs alumni distributed throughout the world. So it's one of the biggest and the very the private university, and it is known for its research and innovation. This is known as a research and innovation driven university. So, and our dynamic chancellor, Dr. Atul Chauhan, who is a very young, energetic, dynamic person, and she has been helping us to guiding us to develop up and up, and then our Honorable Madam Vice Chancellor, Professor Dr. Valvinder Shukla, she could not attend this meeting because her preoccupation, so, but she has sent her best wishes for this workshop of whether CME, Continuing Education Program, and the training workshop. So, for this today, that it's a very important. Sometimes in the last year, in January, perhaps, we have all visited few of you, and I think Dr. Shova. So we have visited that time, and it is important that Russia and India are friends for. We do not know from before our birth it is going on, so we know when we. So it's a long time, but it is maybe more than it is going to be century or more than that. So, but then it is a scientific collaboration, we had a greatest opportunity to have the experts from Russia under the visiting guests. And I think some are also first time visiting. And of course, Madam Olga has already visited earlier. So it's a really good opportunity to interact, and also there are several physiotherapy professionals from the Delhi NCR. We call it Delhi is the capital. NCR is the new capital region. So Delhi and around New Delhi and around areas. So there are several professionals are here, including the partner, Mr. Gautam Sharma, is India. So I would welcome that Dr. Olga Padisova, that you see the medical advisor and Elamed Russia, and the other people who accompany me. This is first time he is visiting Alexei RFEF. I do not know if this is the actual pronunciation or not. I do not know. So this is very difficult from country to country have the pronunciation of the actual name, what it is. And Russia and as well as France is a little difficult, the pronunciations. So, and then we have the Mr. Alexei, he is the commercial director, the Alexei RFU, and then Alexei Ivanov. So he is the medical director and Elamed vice president, and they will be talking to you about this pulse electromagnetic device. I have seen earlier perhaps in January, but they will explain what is that equipment is and how it functions, and it is only that's why the physiotherapy professionals are there, particularly those who are with the neurology, the specializations would be more useful. Also in general, also it could be useful. So along with them also, Ms. Julia is also accompanied. So nice. So it's we are strengthening the friendship through scientific field also, not political and others. But we know, everybody knows in India that Russia is our greatest friend. So it is, everybody knows in India, even from the school children to higher ups. So it's a excellent opportunity. I would wish all the best, and also I welcome all the students and our faculty of health and life sciences, and also the professionals from Delhi NCR. So you could come and join this workshop or the CME, rather it is very rightly renamed as continuing medical education. So something new coming up every time, you have to get acquainted with those systems, and you can use that for the betterment of the humanity and the better treatment opportunity. So it is now to understand how this machine is. Though ethically people say, ethical committee sometimes objects that how you are giving the pulse electromagnetic or electric shock to the patients. But that is within the limit and within the tolerable limit it is given. So this is not unethical. For example, even the chemotherapy which is given to the cancer patient, they say it is unethical that you make the patient almost dying conditions. But for the betterment, ultimate betterment, to get rid of the cancer, you need to go through chemotherapy, because chemotherapy has a devastating effects on the metabolic system, physiology, and your physical appearance, your skin color, hair will drop, and skin color will become dark. But then it is all these things are given, they are very highly toxic drugs. So, but then it is we want to help the person to survive. So like that, here also in physiotherapy, that if some equipment comes, if it is within the limit of the exposure to electromagnetic field, so that it can improve upon their functioning. So that is not exactly that way unethical, because you are going for the betterment of the humanity or the treatment outcome, better treatment outcome. So, with these few words, I once again welcome you for this CME come workshop, and I hope we will have a nice interactions with our Russian esteemed guests and friends. So I would once again welcome all our Russian guests and as well as all the audience here for the excellent interaction throughout the day. It's a whole day program. But I think maybe before lunch we'll have maybe one session just to have the introductory by Dr. Olga. So thank you once again and thank you very much for this workshop.
Thank you so much, sir, for your encouraging words. Such collaboration hold immense promise for the future of patient care and international research. We are delighted to have the driving force behind our collaboration here today. It is our honor to invite you, Mr. Gautam Sharma, Chief Executive Officer of NUAGE Health, to address this gathering. His vision and commitment to bringing cutting edge rehabilitation technology and commitment to India has made in today's workshop a reality. Mr. Sharma, we warm welcome you to the podium.
Thank you so much. I wasn't expecting to be on stage. I was trying to hide on that chair over there. But thank you for giving me a chance to express my gratitude to the dignitaries from the Amity side, Amity University, additional Vice Chancellor Mr. Katpar Secretary, BC Dasji, and Dr. Jaswant Sethi, the Director of AIHAS. I think we were looking to find a partner who has the same passion to explore and develop excellence on this new technology called PEMF therapy. Well, it's not new, it's been there for many decades. Russia has been one of the countries at the forefront and the pioneers in doing research on PEMF therapy. And it's been now many countries like US, Japan, China, many developed countries are now exploring and finding more applications on using this therapy to improve patient outcomes. It is a regenerative science. It's a part of regenerative medicine. It's used with stem cell research as in complementary therapy to improve the results of that therapy. There are different types of PMF machines and devices, and they have different FDA approvals. They are used from all the way from orthopedic department to oncological department. So there are many applications and there are many more studies which are being done to find out even more of how this wonderful therapy works. I think the world is realizing how the body reacts to these electromagnetic waves. There are different therapies using different frequency medicine, like ultrasound, shockwave and all that stuff. And PMF is one of them. So I think it's a great opportunity. I also want to thank our Russian partners from ELAMED to come here and spend their time and educate us all to make us more aware of this therapy and hopefully inspire and motivate us to not just do clinical studies which have already been done in other countries, but also to develop more innovative applications of this therapy, to find out more about the mechanism of actions, the physiological effects of this therapy. So that's the goal, to hopefully bring some Indian innovative studies and offer it to the rest of the world. And that's what excites me. that's what keeps us going. So thank you again, everyone. Thank you to all the participants for giving us this opportunity and for your attention. Thank you very much. Thank you.
Thank you so much, sir, for that inspiring address. We are truly grateful for the partnership between AIHAS and NUAGE Health that has made this program possible. Today is a truly special moment for all of us. We have the honor and privilege to welcome a distinguished expert from Russia, Dr. Olga Budasova, medical advisor at Eramed, Russia. Her expertise in electromagnetic therapy and rehabilitation medicine has been recognized across the globe, and we are incredibly fortunate to have her with us today. Dr. Budasova, please accept our warmest welcome as we invite you to address this gathering. Session. We have a presentation just now, and then we have a session later. Okay. Yes, please.
Oh, where is my presentation? Sort of presentation. No, not this, not this. The next. Surat. Sorry. This one? No. So, that's all. Sorry, dear colleagues. Our meeting is very emotional, and I'm very inspired with your speech, and maybe something I have some changes in my mind, and I didn't understand that we have the agenda to say some words about our meetings. And of course, I'm very happy to be amongst medical fraternity in Amity University. The hospitality of Indian colleagues is amazing. Thank you very much for opportunity to present, to give information about this interesting method, about our element devices, and to be together with our Indian colleagues and Indian doctors. I'm very happy to visit university for the next once more. Yes, and I'm happy that we have the same ideas, the same ways to develop, and thank you for your expectations about method of therapy, about your wish to be together with our information, with our products, and with I think with our country too. Thank you very much.
Thank you so much, ma'am. It is a privilege to have your global perspective and scientific insight with us today. We look forward to learning immensely with you during this workshop. I now invite Mr. Alexei Ivanov to come and say a few words, and I request Madam Julia to please come and help in the translation.
Хочу поблагодарить за добрый прием.
Alexei is really very grateful for your kind greeting.
Я в университете MIT первый раз.
It's his first visit to MIT University. It's his first visit to MIT University.
Но некоторых сотрудников я уже встречал на видео-встрече
But
по
he
клиническим
met
исследованиям.
some people on Zoom meeting on clinical studies.
На меня произвели впечатление, очень хорошее впечатление, та работа, которая проводится в университете.
He's very impressed on the researches and studies I made at the university. It's on a very high level.
И я надеюсь, что мы продолжим работу в этом направлении.
He believes, he is quite sure that we continue our cooperation in this direction.
Спасибо.
Thank you.
Thank you. Все.
Thank you so much, sir. I also would like to invite Mr. Alexei Arifev for a few words.
Добрый день. Здравствуйте. Я первый раз в этой стране. Это безумно красивая страна.
Alexei is his first trip to India. It's a very beautiful country.
Я первый раз в этом институте. Это также безумно красивый институт, безумно хорошие люди, гостеприимные.
It's also his first visit to MIT University, and he's impressed by people who are very hospitable, who are very nice, and
Я очень ценю ваш подход, ваше небезразличие, ваше желание изучать эти технологии.
It's very important for us, for our company, that you are very interested in technologies, that you are so passionate about these technologies.
Я надеюсь, что благодаря нашему союзу мы сможем изучать и создавать что-то новое для людей, помогать им.
He's quite sure that due to our cooperation, we'll be able to do something very positive to help people in their diseases.
Я надеюсь, что благодаря нашей совместной работе с вами мы сможем сделать труд врача, это безумно трудный труд врача, чуть более легким и доступным для пациентов.
He believes that due to our cooperation and work together, we'll be able to make a kind of relief for doctors' profession and also support for the patients.
Спасибо вам.
Thank you so much. Thank you so much, sir. We are now privileged to invite Professor Dr. S.K. Khatri, sir, Additional Pro Vice Chancellor and Dean of Academics at Amity University, Noida, to address this gathering. Sir's distinguished leadership and commitment to academics excellence have been an inspiration to all of us. We respectfully invite you, sir.
Definitely, it's a very important day. As we say that India and Russia are natural allies, natural friends to each other, I think the same applies to Amity and also to NUAGE. The warmth that we can feel from your presence, the love and affection we have with Mr. Gautam and his organization, and respected Sharmaji through his intervention, involvement with which this partnership has begun. Amity, which is established with so much love, affection, vision by our honorable founder president, when he came back from Germany after 28 years, was to serve to the society with cause of education and to make India a knowledge superpower with a contribution from Amity. That is the reason why we have so many presences in India with 12 universities. We have 17 campuses globally, and universities awarding degree independent permissions given to them by the university, the governments outside India. Still, we feel that it's a far long way to go on. We want to be the best among the education institutions when it comes to private sector and among the top
in the world globally. And this cannot be done just with rankings. This cannot be done just with accreditations. It can be done by quality education. It can be done when the students, which are the brand investor, they go to the industry, they go for their own entrepreneurship, they go for higher educations abroad. They talk about us, what they do, what they produce as an outcome. And that is why our Honorable Foundry President always believed that it has to be outcome driven university. Whatever we do at MIT, it is related to outcome. It is related to something which has to be measurable, which has to be quantifiable, which has to be qualitative in nature. All our partnerships are on that line. We don't believe just to have the partnership for the sake of name of having them. We want to have them for the reason which can contribute towards the students, towards the society. This partnership with which we have today and MOU with NUAGE Health, we have it is a very important partnership, very important. I mean, a lot of research collaborations are going on. I came to know a lot of research, clinical projects are also being done in partnership with the NUAGE and AIHAS. And as told by Dr. Alexei and also Mr. Alexei, that they are very, very happy with the responses of clinical research work that is done by our students at MIT. And we do believe that when any organization is having a faith on us, putting efforts for the visits, spending time for interactions, training programs like today, and seeing the students into the university officials, coming all down from Russia, and I love this place and this place. But as mentioned, we were talking of the days of the place when I was in Russia, and I really like the culture. And definitely, they have an expectation, and if we are meeting them, definitely it is something we should be happy about. The institution is putting their efforts in to make sure that whatever support they are giving to us for clinical research, for trainings, and the workshop which is in line of this objective today going to be held now afternoon. We have our experts from outside also. I would like to welcome Dr. Jay Prakash. Can you be going to focus for him, who is chief physiotherapist from Dharmshala and Aran Super Speciality Hospital? And we also have Dr. Meena. Welcome, Dr. Meena, who is associate professor in Indian Spinal Injury Center. Definitely, your speech and your interactions with your experience that you are going to share with Indian case studies is going to be very important for our students. This workshop is very meaningful, and I would expect that all our students are going to learn and take the best out of every second and moment they are going to share. Every line they will speak is going to have an input for you, which is going to be something which is food for thought for coming months and years for you to work on, because they will be sharing all their experience in today's interaction. Mr. Gautam, please present definitely and what you have done in bringing together Amity and Mr. together at one platform. It is because of your organization, and definitely that has given opportunity for us to understand them and opportunity for them to have a faith on Amity and the work we are doing. We want to make sure, Dr. Olga, that what you are expecting in terms of, as it was mentioned, that it's a very satisfactory experience in terms of the clinical research work done by the student, but we would like to do something more also, which can make you more happy that what the faith you have or what you are expecting, it has up to that standards. We do believe that you have been there earlier to Amity, but it's first visit to you for both of you to Amity, and I do believe that we are going to see you more often now. And as you had said that you love the hospitality, I also love the Russian hospitality. The way we were treated when we had been to Russia is always there to be. We had great memories to share Russia. That is something that we have a great time. And Amity and Russia has a lot of partnerships in different ways with different universities. We are working with them. A lot of research collaborations with industry also. And what we are going to do with you today in terms of this workshop, these equipments, development, I think we expect now to have new benchmarks to be set, new expectations to be set from both the sides, and what we can do further, not only as an outcome of our expectations, but also from new plans that we can do. Welcome again to Amity, and we do believe that your visit to Amity, first visit to Amity and to India is going to be a very memorable one. And we do all believe that our students are going to have great moments today. Hearing to all of you, we have a presentation from Dr. Olga as an academic presentation. Then we have presentation from two experts. There's going to be great day students. Please listen to them carefully. Our Honorable Chancellor, sir, who is working day and night, Dr. Chonji, he's traveling so much, he's spending so much time to all campuses in India and abroad, with only vision, with one thing in mind, that we should give the best of the facilities to our students, best of the infrastructure to our students, and make sure that they have that ecosystem, they have that environment that can prove fruitful for them, that can prove meaningful for them, and our students can cherish and prove that what MIT can do, no other institution can do. Welcome again to MIT, and best of wishes for the session. Thank you.
Thank you so much, sir, for your inspiring words. Your words really remind us why this field of medical education and innovation holds such immense promise for the future of patient care. I now begin with the academic session. So, to guide us through the scientific foundation and advanced applications of PEMF technology, we once again invite our international guest for today, Dr. Olga Bodasova, medical advisor at ELAMED, Russia, to present the first session, the scientific basis of PEMF and advanced rehabilitation technologies. Dr. Bodasova brings with her years of research, clinical application, and global expertise that will truly deepen our understanding of this remarkable therapy. Dr. Bodasova, we warmly invite you to take the stage.
Thank you, colleagues. Thank you very much. And let's start this second time, my presentation for the second time. I think that this information will be interesting for you, but we met with you previous year, so some of colleagues know this thing rather good, and I think that maybe you will have any questions about this method. But let's repeat the main information about what is it PMF. And you understand that medical advisor of Elamed company. Elamed is the biggest manufacturer that produces different types of low intensity PMF devices. And then Elamed offers a wide range of low intensity PMF therapy devices like Elamed 02, Elamed Active. And we will present Polymark on the second part of our meeting. And I think that all these devices will have the place in your practice in the future. And what is PMF, or pulsed electromagnetic field? It is an innovative, drug-free, non-invasive, and pain-free therapy that uses time-varying magnetic field to help optimize our body's regeneration and healing processes. Magnetic fields differ in their parameters: origin, intensity, frequency, and motion. And today we will talk about low intensity, low frequency PMF. But I think that it will be interesting to compare some parameters when we use different types of magnetic fields too. What are main mechanisms of action of PMF? We discussed it before our meeting with our colleagues, and I understood that it is very interesting to study information about the influence of PMF to our tissues, to our cells, to our ions, and so on. And PMF effects on ion channels and membrane potential. It activates intracellular signaling pathways. It affects on oxidation reduction balance, promotes regulation of gene expression, yes, It's very important. Effects on our immune system and neuromodulation. And let's quickly repeat how our PMF influence our cells and microcirculation in our body. You can see different pictures, and on the left side we can see that before the influence of PMF therapy, our blood cells demonstrate the Rolex effect. A Rolex effect is that our red cells are clustering together and they can't flow into little vessels, and it is a real problem because it decreases the oxygenation of our tissues and we have different pathological processes in our body. After PMF influence our blood cells, we can see that they are declustering, and we see the picture that it is easier for red blood cells to penetrate in a different type of vessels. We influence our oxygenation, we influence metabolism of tissue, and we influence the restoration of tissue. And on the second pair of pictures, you can see that PMF influence nitric oxide, and so after influence PMF to our vessels, to our body, we have deconstruction of vessels, and it is the second way to improve microcirculation in our body. It is very important for people who are injured or for those who have low circulation to help them to recover faster. Here we continue to talk how PMF therapy works. It increases circulation in blood vessels, of course. It improves ionic exchange via the cells membranes. It improves the synthesis of cartilage tissue. And all these beneficial effects make PMF one of the most powerful anti-aging tools. We have cellular effects and they shape biological effects. And scientific studies have proven that PMF have anti-inflammatory, anti-edemic, anti-coagulatory, neuroendocrine, immunomodulatory, vasoactive, and trophic regenerative effects. What are the advantages of PMF? The inductors of the device can be applied over clothes, orthoses, medical dressing, and so on. It is very good for clinics because it's easy to use these devices. It's easy to use, and it is good for patients that, for example, have different medical fixation structures and so on. PMF has a long-lasting therapeutic effect, not only impacts at the time of therapy, but also after the course is done. So we should have the course of PMF therapy, and after this, we should have a break for nearly 2 months, and we will have the therapeutic effect all this period. PMF therapy also can improve the efficacy of other medical products. It helps drugs and medical fluids to penetrate deeper into tissue. When we influence using our emitter through medical gels, for example, gels with NSAID, we understand that the penetration became deeper and the concentration became higher in our tissue. This method is called magnetophoresis. You know that we have ultrasound methods, nearly the same ultrasound phoresis and electrophoresis, and magnetophoresis is a very effective method too. Moreover, fixed metal constructions, medical structures in bones or surrounding tissue is not contraindication for using PMF. It is important for people who are injured, who has different fractures, and who has medical construction inside. I want to go into many details on this slide, but what I would like to point out is the fact that PEMF can implant anywhere on the body and has a positive effect on different parts of the body's organs and systems, such as vascular, digestive, respiratory system, musculoskeletal system, and nervous system. PEMF has many applications, and you can see the main application on this slide. Thus, we have many benefits in our life after using PEMF. On this slide, you can see indications and contraindications for PEMF therapy. Indications depends on organs and systems, depends on problem, and contraindications are nearly the same when we use all types of PEMF devices. You can see it on this slide, and we should remember about contraindication when we work with our patients. And now we will talk about clinical studies, the results of work with main scientific centers in Russian Federation. We discussed this study with some of our colleagues, but I think that it is interesting to repeat that, for example, we have scientific information about using PEMF in different conditions. On this slide, you can see how PEMF helps us to treat osteoarthritis. The study results revealed that patients treated with PEMF experienced increased reduction in joint stiffness and prolonged remission period for more than 3 months. The next study revealed that use of magnetophoresis with NSAIDs and chondroprotectors reduces pain syndrome significantly and returns patients to active life faster. The next study I would like to talk about is the chondroprotective effect of PEMF therapy. It is most interesting clinical study concerning arthritis and arthritis. It was a double-blind study conducted on 77 patients. It was lasted for 3 years. There were 2 groups of patients. The first group is medication and placebo PEMF device LMAC active, and the second group is medication and LMAC active with PEMF therapy. The trial lasted not 55 weeks period, as I wanted to say. It was the first part, but now we have the 3-year period of this clinical study. Our patient had 3 courses of PEMF therapy each year, 6 courses for 3 years period. And the dynamic of pain at rest was more favorable in group 2 when we used PEMF device. The total WOMAC index was also lower in group 2 compared to group 1. And it was concluded that, according to ultrasound data, in placebo group, cartilage thickness decreased. In the second group, the cartilage thickness remained unchanged. In the group with PEMF therapy, radiological changes. Just a minute. Radiological changes over the observation period were practically absent. The study showed no significantly adverse effect on markers of articular cartilage matrix degradation. It is human cartilage oligomeric protein and cross-linked telepeptide type 2 collagen. The results proved that PEMF not only demonstrated analgesic and anti-inflammatory effects, but most importantly, it also has structure-modifying effects. It helped to maintain cartilage thickness and control further degeneration. This is a great news for patients suffering from osteoarthritis, as it not only provides pain relief, but also improves joint health. This data confirm efficacy and safety of PEMF as the method of non-drug therapy for acute or subacute non-specific back pain, because it was possible to achieve more effective pain control, restore function, and reduce the need for NSAIDs. Let's move on to talk about PEMF effects on the nervous system. One big problem is the post-stroke rehabilitation, and the next clinical study confirms that low-frequency transcranial magnetic stimulation can help patients with ischemic stroke to recover faster. The results concluded that transcranial magnetic stimulation promotes regression of motor disorders and depression, reduces the level of anxiety, improves daily activity and the quality of life. Another important topic to talk about is cognitive impairment that happens with aging. Through this clinical study, we successfully demonstrated that PEMF devices can help with rehabilitation for patients with cognitive impairment. The results of the study showed significant improvement in cognitive function such as memory, attention in patients with mild to moderate cognitive impairment, significant improvement in sleep quality, a reduction of depression and anxiety in patients with mild, moderate, and severe cognitive deficit. A very important aspect is healthy aging is to maintain cognitive function. PEMF therapy devices can help improve the condition of patients with different degrees of cognitive deficit. Migraine is also another common problem these days. Clinical studies done using PEMF device Diamag produced the following results: analgesic, pain relieving effect, reduction of migraine symptoms, and normalization of psycho-emotional state. Another clinical study with migraine showed us that PEMF therapy lead to decrease in pain intensity, decrease in the incidence of attacks, and decrease of NSAID and triptan consumptions. Moving on, let's discuss PEMF effects on the respiratory system. Very often we see pneumonia following COVID-19 infection. Maybe it is not very actual just now, but we have different problems with lungs even in 2026. And PEMF devices can help us to make vital capacity of lungs and chest excursion better, to overall to improve the mobility of our patients and reduce the shortness of breath. Sometimes these patients visit therapists, sometimes these patients visit neurologists, and we should deal with this problem even in 2026 too. Study I want to show you, it is a rather new study, is about the rehabilitation of patients with arterial hypertension combined with chronic cerebrovascular pathology. It shows positive dynamics with a reduction of blood pressure, the frequency of vertigo, and improvement in the quality of life after the course of action. The use of low frequency running, low intensity pulsed electromagnetic field in the basic treatment of patients with chronic venous insufficiency with lower limbs is effective too. And now, let's discuss element devices. I'll start with LMAC 02. Why? Because this device is rather interesting. It has 79 pre-installed programs. It has 3 types of emitters. It has different types of penetration of PEMF. For example, a local emitter can penetrate deeper into tissues nearly 15 centimeters, and other emitters can penetrate PEMF into tissues for 8 centimeters. So we can influence different types of tissues. We can influence muscles and we can influence internal organs. In this device, we have 4 types of emitters, frequency from 1 to 100 Hz, and intensity from 2 to 45 millitesla. The next device is LMAC Active. You know this device rather good. There are 3 modes for adults, for kids, and a specific third mode that has analgesic and anti-inflammatory effect. And the main point of treatment is the combination of methods. For example, when we have acute period, we use the third mode of LMAC Active, where we have frequency 100 Hz. And when we have chronic process, and maybe some days after the acute period, we use mode number 1. And the combination of these 2 modes gives us the best effect in the treatment of different pathology, even when we have problem with acute pain, and even when we have problem with chronic pain. LMAC 01. LMAC 01 is very simple. It has only 1 line of emitters and only 1 mode. But some people like to use it because it's simple to use. For example, it's very simple to use at home. MAX 30. MAX 30 is very compact, and it is local PEMF device for local problems. For example, local trauma, maybe arthritis of little joints, and so on. It can help us to deal with some problems, but I think that bigger devices are most interesting for clinical studies and for universities too. Megaphone. Megaphone is a combination of 2 factors, the PEMF and vibroacoustic vibration. So we can treat such interesting situation, for example, like adhesive processes, because we have vibration and we influence vibration using 2 factors. DIAMAG. DIAMAG is the device for transcranial PEMF therapy. There are 4 pre-installed programs in this device, and we treat migraine, we can treat different types of headache, not tumor headache. We can treat different types of dyscirculatory encephalopathy, for example, hypertensive encephalopathy, atherosclerotic, metabolic, and so on. And we can deal with problems with sleep and some other diseases. And we can work with patients on the period of rehabilitation after the ischemic stroke. And I showed you the clinical study about the cognitive deficit. And it's really a problem just now amongst people, because many old people have cognitive deficit. It is the comparison. The comparison of low intensity PEMF and high intensity PEMF. Why I decided to compare these 2 methods, because we should understand that we have different types of PEMF devices, and it will be more. We have a comparison of 2 methods, but it is more professional to compare 3 types of PEMF devices. Very low intensity PEMF devices, lower than millitesla. These parameters are good for immunomodulation and for influence for the whole body, for the whole organism. Then parameters from 1 millitesla to nearly 45 millitesla, it is medium parameters, and all Ilamed devices are in these medium parameters. And these parameters are as a gardener, because it is influenced very, very correctly to our tissue. It's try to make our tissue to react their selves, to start our reactivity, to start our metabolic processes, but it is rather effective. As when we speak about the high intensity therapy, it is rather aggressive method of depolarization of our cell membranes. It is very effective when we deal with acute pain, for example. But if we need the prolonged results, if we need the, for example, chondroprotective effect, we should use the medium parameters of PEMF. And on this schedule, you can see the compare with high intensity transcranial magnetic stimulation and low intensity magnetic stimulation. DIMAC is low intensive magnetic stimulation, and we use DIMAC when we have problems with oxygenation, blood circulation, cognitive impairment, and so on. And high intensity we can use only in some ways in clinics when we need to activate some brain zones. It is not for long-lasting therapy. It is not for recovery. It is only for. It is only about the stop the symptom just now. And some words about Polymag. Polymag is the big stationary device. I will have 15 minutes in the second part of our meeting. I'll try to show you Polymag and to discuss all opportunities of this device. It is the best device, I think, that Elamed produced in this period of time. I'll show you later. As about this slide, I want to say that that we can combine low-intensity PEMF with different physiotherapy methods. And it is good when we combine with ultrasound, for example, with electrostimulation, and we can combine with cryotherapy. And caution is required when we combine it with deep heating modalities such as ultra-high frequency therapy and infrared radiation. But low-intensity pulsed electromagnetic field is an excellent team player, and we should use all our opportunities to have a holistic approach to our patients. Very quickly, I show you the main pathology when we work with PEMF devices. It is some problems with musculoskeletal system, for example, osteochondrosis, different types of arthritis, nervous system, injuries and traumas, circulatory system disorders. And you can see that, for example, wounds, we can use all types of devices. But we should understand what device is better, and we will discuss it on the second part of our meeting. Nervous system diseases, digestive system diseases, respiratory diseases, and so on. And I think that you all agree that PEMF is the very promising method of treatment and rehabilitation, and it will be interesting in your practice. Thank you very much for your attention.
Thank you so much, ma'am. That was extraordinary, insightful presentation. The depth of scientific evidence you have shared will certainly shape the way we approach in rehabilitation in years ahead. We are deeply grateful.
We now arrive at a very special segment of today's program, which is the felicitation ceremony. It is our humble and heartfelt way of expressing gratitude and honor to our distinguished guests, whose presence, knowledge, and generosity of spirit have made this day truly extraordinary. I request Dr. Sethi, Dr. B.C. Das sir, and Dr. Khatri sir to please come forward for the felicitation program. Firstly, I invite Mr. Alexei Arefev, the commercial director of Elamed Russia, for the felicitation program. I request Mr. Dr. S.K. Sethi sir to present a token of appreciation to Mr. Arefev. I now request Dr. B.C. Das sir to please felicitate Mr. Alexei Ivanov. I now request Dr. Jasabanta Sethi sir to please felicitate Madam Olga Budasova. A huge round of applause for our delegates. I would again request Khatri sir to please felicitate Madam Julia. Ma'am, please come on the stage. I would now request Mr. Gautam to please come on the stage and join us here. I request Dr. B.C. Das sir to please present him with a token of appreciation. I would now request Dr. Sethi to please. I now request Dr. Sethi to please felicitate Dr. Meena Makhija for her upcoming academic session. I would also like to invite to stage Dr. Jayaprakash Jayavelu for his upcoming academic session. As we conclude with the felicitation program, we have a very important announcement to make. A huge congratulations to our team present here for the inauguration of the PEMF lab in F1 LG19 room. I request everybody on this dais and our delegates to please come forward for the inauguration ceremony at the lab. Dr. Ankita will escort the guests to the lab. After the inauguration ceremony, we will conclude the lunch outside in the F2 foyer. I request everybody to please have your lunch and then come back for the academic sessions.
And are refreshed and are ready for an equally enriching afternoon session. We now commence academic session 2. which promise to equally be insightful and practically valuable. We now turn our attention to the cutting edge of the clinical research. It is a moment of great pride for AIHAS as we invite Professor Dr. Jasubanda Sethi sir, Director of AIHAS, to share an important clinical trial update on PEMF, applications in tennis elbow, rotator cuff injury, stroke, and ACL injuries. Sir's research, leadership, and commitment to evidence-based practice inspires us all. We respectfully request you to present this important update, sir.
तो लग रहा चालू करना हुआ मेरा पहले दिखाने देता हूँ. So, good afternoon, everyone. This afternoon session is a little drowsy. So, hope I request Dr. Pankaj and all please sit down and talk, if possible, the backside. Dr. Pankaj, Dr. Priya Chauhan, yeah. So, I am so honored to present before you this MAG 30 efficacy on sports injuries. Dr. Olga, I think you remember that this MAG 30, I think Mr. Gautam is not here. I would request Ms. Julia if you can translate in between. We had taken that MAG 30 from Mr. Gautamji, and this is the first study we had taken on this lateral epicondylitis and sports injuries among the racket players. So, as today morning we discussed that already the pilot study has been presented in one conference and already gone for publication in Web of Science Index journal. So, hope she will translate it. Yeah. So, here we have this full-fledged study, what we are going to present. So, this is the effect of pulse electromagnetic field therapy in racket players with lateral epicondylitis. And this Arushi Singh, Jaswant Sethi and Manish Gupta, where the Arushi Singh is the PI and me the guide and Manish Gupta is the co-guide for this. Here the background is lateral, about the lateral epicondylitis, all of us know very well, all the clinicians in the behind. It's very common this faced to many of the sports persons. With so many sports specific and sports non-specific background. So here we have the aim is to find out the effect of PMF in racket players with lateral epicondyle, whereas this objective was to evaluate this PMF on pain, range of motion, grip strength, functional performance in racket players with lateral epicondyle. Kindly, excuse me, with a little bit the mistake in the typing by my PI. So, and here we hypothesize that the PMF therapy has no significant effect on pain, range of motion, grip strength, and functional performance, whereas this alternative hypothesis was has got significant effect on these four parameters. These are the inclusion and exclusion criteria. So kindly go through this from still the mental implants and the pacemakers and as exclusion criteria. Here in methodology, we have taken the 68 racket sports players, this 18 to 35 years with the clinical diagnosed lateral epicondylitis, were randomly assigned to the control group and the experimental group, where the N is 34 each. We are given this MAD 30 with intensity 30 millitesla with a time period of 15 minutes in the experimental group, whereas in control group we are given the conventional therapy. And of course, as in the statistics, these groups were before allocation. We were calculated with this Sapir-Whorst test and done in the normality and for the data, and then take this pre and post analysis. And this in the methodology, I just see that here the single blind parallel group randomized control trial as a study design taken place in this OPD of Progressive Physiotherapy Center in Sector 12 Noida. With the sample size as mentioned earlier, it's just evaluated with this D, points D was 0.91 with this references of the pre-existing studies with the level alpha was 0.05 and here in the control group we had just taken this given the conventional therapy, whereas the PMF as well as conventional therapy was this applicated or applied on the experimental group. These are the parameters and the tools: pain, grip strength, functional performance, range of motions. Here we result we just found out that look at this one in the pain. We have seen that in the control group where the blue and this bars is the this trial group that's in the peach color. This pre-post could say that we have got a significant clinical as well as the statistically significant in the pain. Here also in grip strength also to increased in the this post better than the control group, and this in the range of motion also we got the good outcome, as well as this functional performance here. This PRT scores to be decreased, then the performance is increased inversely. That's why we just got it to this lower this speech color in the post test. In discussion in the brief that we have this, we got this good significance effect, and with the existing neurobiological supports and the tissue level in the healing, thereby we got this relief of pain on the spot, and we can get this increased range of motion and increased strength plus good performance in the later. So this concluded with this better findings in experimental group in MAG 30 with 30 millitesla. That was very good, and of course this will be the second publication and abstract with Web Science Index journals very soon. And this in a broad we'll be sending to another journal for the whole study of the dissertation topic. So thank you so much. With this I just thank you.
I would now like to call upon the stage Dr. Sanjeev Kumar Das, sir, for the clinical trial updates. We are really sorry for the delay due to some technical glitches. Our next session brings a highly relevant clinical perspective to our discussion. It is our privilege to invite Dr. Meena Makhija ma'am, Associate Professor at Indian Spinal Injury Center, New Delhi, to present on the recent advances in orthopedic rehabilitation with PEMF therapy. Dr. Makhija's clinical expertise and academic contributions in spinal and orthopedic rehabilitation make her uniquely placed to address this important topic. Ma'am, we warmly invite you to come forward and share.
Good afternoon, everyone. First of all, I want to thank Amity University, Sethi sir, Ankita, Dr. Ankita, Dr. Ritika for the coordination and for the warm invitation and welcome. I am thankful also for the purpose that by virtue of this talk, I read many articles about this. Thank you, Sethi sir. I was not updated on this, and this talk has made me more updated. So I'll be talking about the articles which I could get, the review and the meta-analysis which I could get in relation to orthopedic rehabilitation. Dr. Olga talked about its effect in neurological, respiratory, digestive, and other systems. So I will be restricting my presentation to orthopedic rehabilitation. So the talk was basically what is PEMF, which we have already covered. Mechanism of action is being talked in detail by Dr. Olga, and orthopedic applications, clinical evidence, treatment parameters, which I could gather from different articles. Expert would be Olga ma'am to guide us, and then safety and conclusions. So basically, what we learned in the morning session is that it delivers pulsed electromagnetic fields to the biological tissue, which induces electric currents that modulate cellular processes. This therapy is entirely non-invasive, non-thermal, and drug-free. So 1970s, the Bassett et al. Pioneered PEMF. In 1979, it got FDA approval. In 1980s, its effect were extended to soft tissue and wound healing, which were there initially for non-healing fractures, and then the evidence is growing day by day. Mechanism of action is already discussed. There are some good articles which I came across and on the mechanism at a cellular level, which are very good to read on. I am not going into the details. So in my presentation, broadly the areas which I could find in terms of orthopedic application were bone fractures for the non-healing and delayed union fractures, low back pain in which both non-specific and lumbar radiculopathy patients were benefited. Osteoarthritis, I could gather literature on knee OA, hand OA, cervical patients, and it was quoted in the articles that chondrocyte stimulation was evident in osteoarthritis patient. Few researches were also seen on shoulder impingement. I was discussing with Sethi sir that I couldn't gather any reference on tennis elbow. So post-op lumbar pain is also being studied in some literature, and research is growing. They are studying it in various soft tissue and other conditions as well. So this was a review on bone fractures, and it was published in 2024. It included, considered 692 studies. These were screened and included 3 studies, 197 patients. So although they did not get any no significant effect on acute fracture healing, and the pain relief was also contradictory, as one RCT showed significant short-term pain relief and other did not. In range of motion, they said that there was a benefit in wrist range of motion and grip strength. So for acute fracture healing, they were not supportive for the PEMF. But again, one trial will not suffice. We have to do many to come to a conclusion. Coming on to low back pain, this is another article which is published in 2023. It was a randomized control trial. So what they did was they took PEMF plus conventional versus sham plus conventional. 4 weeks intervention, 10 sessions, 1 to 50 hertz, 10 minutes per session, and the outcomes were VAS, ODI, and lumbar range of motion. They found significant improvement in pain and range of motion, and there was decrease in disability. Then we come to osteoarthritis. I got a meta-analysis which was published in 2018. It included 12 RCTs. The pain, this meta-analysis includes knee OA, hand OA, and cervical OA. In knee OA and hand OA, they found significant differences in pain and function score. However, in cervical OA and spondylosis, they did not get any significant differences. The good part is that no adverse event was reported in these subjects. Coming on to lumbar surgery and shoulder impingement. In post-op lumbar pain, which is a failed back pain syndrome, they found that there was reduction in pain, there was faster recovery with people who were getting PEMF. They also said that inflammatory markers were decreased in PEMF group. And in shoulder impingement, again, there was short-term pain function improvement. However, in long-term pain relief, in shoulder pain, they did not get significant mean difference changes. Coming on to treatment parameters, which I could gather and experts will tell you in future of how we go about. The literature which I was getting for analgesia, usually low frequency was taken, then mid for tissue repair and high for muscle relaxation. For intensity, anti-inflammatory effects were less than 10 millitesla, and then functional capacity for was with more than 10 millitesla. Session duration was ranging from 10 to 60 minutes, and evidence is that less than 30 minutes per session shows better outcomes. So it is not that you keep on giving it for more and more duration. Usually the trials which I could gather, it was ranging from 2 to 8 weeks, for acute pain 2 to 4 weeks, and for chronic 4 to 8 weeks. Self-administration was a big learning for me, that patient can use the equipment at home and they are getting benefits. Frequency was usually ranging 3 to 7 per week, and application was either coil or pad. So if we talk about safety advantages, no significant and adverse effect was noted in any of the meta-analysis, and only minor events like petache or erythema was noted, which also resolved in 24 hours, which is a good thing for all the therapists who want to use this equipment. Since there are no thermal effects, non-ionizing radiation, and patient compliance was also good, and patients were tolerating this machine well. I told you that self-administered at home is a big change in the rehab, and patients were getting improvement. It is drug-free, so no side effects. Contraindications, ma'am has already shared with you. So what I would say that we need to have standardized protocol and more published article in relation to orthopedic rehab. We need large RCTs and long-term follow-ups. Moreover, one thing which I would suggest my students and all those budding professionals who want to do research in this arena, I could gather pain, range of motion, disability, strength,
But if the biomarker-driven response assessment can be accommodated, that would be very helpful for this modality propagation as well. So my take-home message is that it is a clinically viable adjunct in orthopedic rehab, although we don't have to challenge our conventional therapy, but as an adjunct, if this modality is given, this modality can do wonders in many. So more randomized control trials are needed to confirm its efficacy, and now the work is for us how we use this and give randomized control trial to our profession. Thank you so much, and thanks for the opportunity.
Thank you so much, ma'am, for your clinical insights. They have added tremendous practical values to today's program. We are truly grateful for your contribution. Pain management remains one of the greatest challenge in clinical physiotherapy and rehabilitation. For session 3, it is our honor to invite Dr. J. Prakash, Chief Physiotherapist at Dharamshila Narayana Super Specialist Hospital, New Delhi, to speak on the use of PEMF in pain management. Doctors, yes, no, please.
Good afternoon, everyone. And before the introduction, I just walked in. So myself, Dr. Jay Prakash, I'm the alumni of Amity University, and the guidance of Dr. Sethi, I've completed my PhD in Amity University. So thank you, Sethi sir, for inviting me. Thank you for inviting me, and this always kindles me to learn about PEMF. And a year back, maybe I took the treatment of PEMF for myself. I had a neck pain. I went to a senior therapist, and then he said, you take this treatment. Only one session I took it, and I felt better. And because of Sethi sir, I learned. I looked into the various articles, as Dr. Meena said rightly, and it was really interesting. And we've already for our Narayana Health, we already budgeted for getting this equipment for this financial year. Probably we'll be having it another 3 months or 6 months down the line. So before the topic is pain management with the use of pulsed electromagnetic field therapy. In today's scenario, one is that assessment remains the key parameter for any treatment approaches. A proper assessment and right use of the equipment is very important. And there's wide variety of PEMF is available, high intensity, low intensity, and it's similar to I spoke to a neurologist yesterday who is 75-year-old, and she said okay, it is more or less similar to TMS, transcranial magnetic stimulation. And I went to the articles also. There was some similarity within various this thing, but still, what I briefly am going to tell, Dr. Volga can correct me if I'm saying anything wrong. Pulsed electromagnetic therapy is a non-invasive, non-thermal treatment that utilizes pulsed magnetic field to promote healing and manage pain by stimulating cellular recovery. So whatever I'm going to tell, it's more or less redundant, but there are a few key points which I want to highlight. Its benefit, it improves the blood circulation, and it helps in the muscular repair, and it reduces the inflammation, and it is an anti-allergen, and it helps in bone repair, and it is pain relief for various conditions and boost immunity. And the key, another important thing, point of interest is neuroplasticity. Okay, neuroplasticity also indirectly it induces neuroplasticity, and it's very useful in stroke patients. That's what the literature says. So physiology, PEMF interacts with biological tissues at physical, biophysical and biological level. As Dr. Meena said, in physiotherapy, the research aspects, biomarker induced, biomarker, we are not using the biomarker as a dependent variable. It will be better if you use the biomarker as a dependent variable, and you can also measure like, okay, what are the biomarkers in serotonin level, how the serotonin level is like changing, and what is an effect on calcium levels and other parameters also you can look into it, which will help us to understand more evidence-based practice rather than like, okay, more of a subjective like, okay, parameters. Electrical induction following Faraday's law, time-varying magnetic field induce low intensity electrical field in the tissues, and cellular response ion movement stimulates the movement of calcium ion through the cell membrane, and the key parameter nitric oxide cascade enhances the calcium binding to calmodulin, triggering nitric oxide release, which acts as a potent vasodilator to improve the blood flow. This is the important thing, nitric oxide, because for, many people, physio community may not know much about the like, okay, nitric oxide unless and otherwise they worked in a pediatric cardiac thoracic unit. In a pediatric cardiothoracic unit, nitric oxide value is different. It helps, like in pediatric cardiac surgery, they use it for inducing pulmonary vasodilatation. So it induces pulmonary, this is like, okay, PEMF increases the nitric oxide like, okay, and it causes vasodilatation and muscle relaxation. ATP production influences mitochondria to increase the cellular energy and fueling the repair, and it also regulates pro-inflammatory cytokines and inhibits COX2 enzymes. For a cardiac health, many people take COX2 enzyme inhibitors for a cardiac level, but PMF is a non-invasive approach which helps in like, okay, probably research can be done in to find out the effect of PMF in reducing the cardiovascular diseases also. So there is a physiology which I already discussed, like, okay, the calcium, it opens up the calcium channel, it increases the nitric oxide stimulation, and it causes the muscle relaxation, various other things. Although like some of these like terms looks like a jargon for me, but like probably okay, we'll look into it and gradually down the line. And also, as Dr. Makija said, like, okay, it helps in like bone healing, and it can be used for various categories of like, okay, bone healing. And probably like there are people now approaching, for increasing height of the patient, height of the people, they are using Elizarov technique. Have you all heard of it? Elizarov technique in increasing height. Probably like PMF can be used for that purposes also. I hardly have seen any literature for that, but probably I'm just saying that new point of thought. And pain management, what are the mechanisms? It's a neuronal blockade. High intensity pulses can induce sensory inhibition and immediate pain relief. And second is hyperpolarization. Still shifts the resting membrane potential of neurons, making it harder for pain signals. And third is CNS reconditioning. Periodic windows of reduced pain allows the central nervous system to reverse the maladaptive neuroplastic changes. And opioid interaction, that is, we influence the endogenous opioid system, potentially reducing the need for pharmacological. And when I used it, it caused the muscle contractions. When I use PMF on myself, it caused the continuous muscle contractions, and it helps in relaxation of the neck muscles. So clinical indication, as has been discussed in detail already, it helps in bone repair, it helps in various joint disorders, osteoarthritis, rheumatoid arthritis. It helps in, like as Siti sir said, like tendinitis, like tennis elbow, bursitis, Achilles tendon. I had an article like seeing that like tennis elbow has been used, chronic pain, low back pain, fibromyalgia, and neuropathic pain, and post-surgical conditions, management of post-operative edema, and particularly lymphedema. I think like Dr. Olga explained about the lymphedema, how it is used, and wound healing. Contraindication, the one thing which I tell all my physio fraternity is like, do no harm to the patient. Do no harm to the patient, because there are in a clinical setup, what happens is like we have like wide categories of like therapists attending to a patient. There is a therapist who may be an intern or who is having 1 year of experience. There may be a therapist with 25 years of experience. Patients are referred to a physio department thinking that like 25-year experienced therapist is seeing all the patients. So I always instruct my interns and other things, do no harm to the patient. First of all, when they address any patient, they should know what not to do. So as we said, like contraindication is the first and foremost is like pacemakers, defibrillators, and cochlea. Already like this has been explained by like Dr. Olga. but reiterating on that point. And pregnancy is again a contraindication, and active bleeding and hemorrhages. But in today's scenario, we always miss out. We always, even in physiotherapy department, in my department also, we started giving TENS to a pacemaker patient. Pacemaker patient having a pacemaker, right above the pacemaker patient used to, therapists used to do that. Because complete history taking is very important. Focus on contraindications, whether not only for PEMF, for any other equipments also. Research evidences, this has also been discussed. There has been meta-analysis. I think like Dr. Meena discussed in detail about research analysis, meta-analysis and systemic review. There's a lot of researchers are there. So in conclusion, as I said, like it is a non-invasive drug-free treatment. And nitric oxide cascade is there, and its effectiveness is often etiological specific. You have to use the right treatment approach, right combination of like treatment, right duration and right frequency. It's not that patient coming to a clinic and you use PMF and you use TENS and you use infrared radiation, you use just to increase the duration and duration of therapy, and then making a patient happy with the help of like time duration and other things. It has to be like etiology specific, like treatment should be given. And again, like there should be standardized protocol, like still like lacking, because we have like, as Dr. Olga has shown, different varieties of PMF. There should be like standardized protocol saying that for what condition, what frequency we can use it, and what other parameters, intensity and duration has to be more specific, and we need to work on establishing a clinical protocol for that. With this is references, and once again, thank you for giving me an opportunity and making me learn about PEMF. I'm still learning. Thank you very much.
Thank you so much, sir. That was a very compelling and clinically rich presentation. The practical insights that you have shared with us on PEMF-based pain management will certainly be applied to practice by many of us present here today. I would now like to call upon the stage Dr. Sanjeev Kumar Das, Associate Professor, Department of Physiotherapy, AIHAS, for his presentation.
Good afternoon, all the dignitaries, faculties, guests. Because of the technical issue, I had to come again. So initially, when we had the device, we planned the researchers. We had a discussion of conducting a study of dosimetry optimization, mostly on the ligaments, particularly the ACL injuries, as it has been unexplored. Though PMF has been considered to be having benefits in several musculoskeletal conditions, but because of the polymag was unavailable, we had to carry out a study on ALMAC 2.0. The study which we wanted to conduct was the efficacy of the pulsed electromagnetic field therapy in the ACL injuries. But then to have a preliminary understanding, we carried out a pilot study. So the study was on the pilot study, which is investigating the efficacy of the PEMF on the ACL ligament injury. The reason behind conducting the study on the ACL injury because of its prevalence. In India, we have seen the young people around 18 age to 25 age, particularly of sports related, they are very much affected with the ACL injuries. Around 68.6 out of 1 lakh people are suffering from ACL injuries. And of course, the same remains in the global aspect also. And particularly the cause of pain is in grade 1 and grade 2, partial tear in ligaments. This is Dr. Jayaprakash has already explained on this. Basically, what we understand from the study which has been conducted by the NUAGE and PSNO 2020 regarding the production of nitric oxide, when these pulse they have an effect causing depolarization in the plasma membrane that causes influx of the calcium ions, and with the elevated calcium ions that uh, causes its binding with the calmodulin. Now that also again activates an enzyme, and because of that it leads to nitric oxide production, and basically this is in the helping in inflammatory and beneficial effects on healing responses. So we have found several studies like Poly 2020, Orphe 2020, Ranbury 2024, Kim et al 2024. These are recent studies which has been conducted on that its benefits in the inflammations, regulations, angiogenesis, that is new blood vessels formations. Okay, glycolysis promotions. So basically, it's a safe and non-invasive treatment which is being given to the muscular rehab. So finally, we assured ourselves that we can continue a study on the ACL injuries, and partially and particularly because not much explored of ACL injuries. So let's have a pilot study. So several literature review has been meticulously conducted by us, and finally then we have come up to the point of annual scientific productions, where we get to say that it began from 2004, where it was early research activity, but eventually it kept on increasing, and then in 2023 we have seen the high rise of the studies on PEMF. There are several international journals where we have seen that the PMF studies are existing. Now, this is something very interesting which we have carried out while we are conducting the literature search. As you can see here, this is looks like a hub and spoke pattern. Hub and spoke pattern where pain is the central keyword, and you can see the years are being given from 2005 to 2025. So you can see the recent studies are on the knee replacement, biomechanics, strength, rather than the previous studies which was conducted on osteoarthritis. So you see, this gives us an idea that recent studies on PMF is being carried out worldwide, and the trend is showing that the evolution from the broad clinical studies to now targeted functional and rehab focused research in PMF. Okay, so let me talk about the methodology of our pilot study that we have conducted. As you can see the picture of the device in the slide, where we had tried to see a very short-term clinical PMF effect, that is 4-week intervention effect with the help of ALMAX02 device, as you can see in the slide. Participants were included based on some inclusion and exclusion criteria. They were pre-diagnosed with ACL injuries, and definitely we have taken care that all the contraindicators are being removed from our present pilot study. So 20 participants, a very small population, has been taken, and along with the standard rehab, we applied the PEMF 3 sessions per week. Total 4 weeks, 12 sessions were there. The density amplitude was 6 millitesla. The pulse per second was 16 Hz, and the exposure time was 30 minutes. We have not done any dosimetry optimization. We have tried to carry out from already existing studies on other ligaments. Of course, before conducting the study, we have carried out the approval from the ethical committee. The outcome measures that we have used in the present study, where we have taken the data pre-interventions, after 4 weeks, post-interventions, the NPRS scale for pain assessment, range of motion, then IKD CSKF, that is International Knee Documentation Committee Subjective Knee Evaluation Form, and finally the SF36, which is quality of life. So as you can see in the results, the variables are being given where the data were analyzed with 5% level of significance, and statistical significant difference were found in all the outcome measures after 4 weeks of the interventions. As you can see in the slide, there is substantial pain relief post interventions, improvement in the knee flexion or function and joint mobility, the physical and the mental well-being, that means the SF36 score, all have shown a significant difference, and of course the larger effect size shows strong clinical improvement. Uh, this we have carried out on the patients based on the program number 23, which was there in the manual. We have applied the emitter on the knee. So finally, the discussions, I believe, is based on the physiological mechanism which we have already discussed. Dr. Jayaprakash has also discussed. Dr. Makija has also discussed. Conclusion is the findings indicate a positive therapeutic effect of PMF, particularly in grade 1 and grade 2 ACL injuries. We have not included the grade 3. So we are planning to go ahead with the larger RCT studies, might be a dosimetry optimization studies later on. The study can also be conducted on the post-surgical ACL reconstructions. Thank you.
Thank you so much, sir, for your valuable insights. I now would like to request Dr. Ankita Sharma, ma'am, for her presentation. We are pleased to have with us Dr. S.K. Srivastav, sir, mentor AIHAS, in our gathering today. I warmly welcome you, sir, to the CME cum training workshop on pulsed electromagnetic devices held in association with NUAGE Health Pvt Ltd. I would like to invite you on stage to say a few words. Let's have a big round of applause for sir. Sir, I would like to introduce you to our guest from Russia, Madam Olga. Then we have Alexei Erkev, Alexei Ivanov, and Madam Julia.
Very good afternoon and very warm welcome to esteemed guests from Russia. Uh, a good delegation that we are waiting for the long time. Thanks to Professor Jasubanta Sethi and his team who made it possible today. And I am sorry I could not attend in the morning because of my preoccupied schedule somewhere else. But I still my time today to meet all of you and hope this bonding will go far and we will be definitely meeting your requirement and would like to advance our knowledge and your expectations as well. So thank you all. I hope your stay, your food will be comfortable. And if anything wrong with us, please excuse and ask with for further what is required. So thank you all. Thank you, AIHAS team, and thank you for the delegation from Russia. Thank you very much.
Thank you so much, sir, for your inspiring words. I would now request Dr. Ankita Sharma for her presentation.
A very good evening to everyone. I would like to present you the clinical update on post-ischemic stroke rehabilitation, basically on motor function, cognitive recovery, and quality of life. So when we got a DIMAG in our institution, so we thought of doing something on stroke rehabilitation. We searched a lot of literature and we found that there are only 8 published research papers which are saying that yes, PMF is effective in cognitive function, post-stroke cognitive impairment, it is effective. But none of them were talking about the PMEF therapy which has been developed by Element. So we took this particular topic. So, ischemic stroke, as we all know, that it is a leading cause of long-term disability worldwide and resulting in significant impairment in the motor function, cognition, and overall quality of life of the stroke survivors. So, although there is lots of advances which are going on in neurorehabilitation, but patients are experiencing their independence is gone and their well-being has been reduced after stroke. So, in recent years, PMEF has emerged as a promising non-invasive adjunctive therapy modality which is aiming at post-stroke recovery. With the PMEF is applying low-frequency electromagnetic field to the body, promoting the beneficial electrical and chemical processes within the tissues, which Dr. Olga has already talked about a lot. The researches indicates that it can stimulate the neuroplasticity, the brain's ability to reorganize and form new neural connections, thereby supporting the functional restoration, which has been already studied by the researchers, and they are saying that yes, it can improve the certain parameters which are there with stroke. So previous studies has majorly done the researches by magnetic stimulation by using RTMS. None of them has used PMEF. So to evaluate the effectiveness of PMEF therapy to standard physiotherapy was the aim of this particular study. We focused on motor function for both upper limb and lower limb, cognitive ability and quality of life in adults. So this study included 22 ischemic stroke patients, which were considered by calculating from the sample size calculation. They were the stroke patients majorly from 30 to 60 years of age. The brainstorm recovery stage we took for this particular study was more than 3 for the proximal and both lower limb. The cognitive impairment score taken for this particular study was between 15 to 25, so that they will be able to understand the commands we are giving them. The upper extremity scale for FMA was taken then less than 20. If patient was not able to give the consent or not able to take our directions and having modified Ashworth scale more than 3, if a stroke patient is pregnant or having any implanted cardiac devices, visual or hearing impairments, they were excluded from this particular study. So outcome measures which were taken were upper limb motor function scale, lower limb motor function scale, global cognitive function scale, and stroke specific quality of life scale. So the tools which we have used for this particular study was DIMAG. The DIMAG device is specifically designed for the management of neurological and cerebrovascular condition, particularly which are affecting the brain. The principle of operation was basically based on that this particular device can improve microcirculation, it can improve cellular metabolism, the neural conductivity, and neurovascular regulation, which we found that the PMEF is doing this by the previous researchers. The DIMAG is a certified low frequency, low intensity PMEF device stroke patients. It delivers extremely low frequency pulse magnetic field through 6 emitters which are placed completely around the head, creating a traveling magnetic field for neuromodulation and improved cerebral circulation. In this particular study, we used program 3, mode 3, which was delivering approximately 40 hertz frequency and 5 to 7 millitesla intensity. This mode was used due to its known recovery for stroke. The emitters were positioned around the head with each north pole directing towards the affected hemisphere that we have already came to know from the people from Elamed that this particular way to be used. Each session was lasted for 10 minutes and 20 sessions were delivered throughout the duration of study, which was 4 months. Now, this was the procedure. We included people, took the informed consent, baseline measurements were taken. They were randomly allocated in 2 different groups. One group was receiving PMEF, other group was receiving only exercise-based physiotherapy. There was no other modality which has been used for control group. 4-week intervention was given to them, and that each session was given by DIMAC, and physiotherapy, cognitive engagement task, motor retraining, and strength exercise was given for the conventional group. So for that, after that, we took the post-treatment assessment and the data was analyzed. So after analysis of data, I'll say that we have not completely did the data analysis for this particular study, but whatever we have done till now, I'm presenting that. So we found that cognitive function was improved, although there was improvement in both the groups because the other group was also following the conventional physiotherapy techniques. But the experimental group was significantly better as compared to the control group. So for cognitive function, the experimental group improved by 3.36 points on MMSC, which is saying that this is a minimum detectable change. This threshold is above than minimal detectable change for MMSC. The quality of life also improved for both the groups, but it was better than in the experimental group using DIMAC. For upper extremity motor function, the upper experimental group improved better as compared to the control group. Then for lower extremity motor function scale, the experimental group improved by 8.45 points on FMA LE compared to 4 points in the control group, indicating that there is better recovery in gait, balance and mobility by using PMEF. So if I cut short all the results, I will say that experimental group exceeded clinically meaningful thresholds required for the recovery for MMSC and FMA UE upper extremity scores, but which we didn't took as the major outcome measure. In the start of the study, we found that lower extremity function, which indicates better gait, balance and mobility, was the greatest improvement by the use of PMEF, which is slightly different from the existing literature. Existing literature is saying that this is effective on cognition, but our study has concluded that this is better for the improvement in lower extremity function. Still, we are doing the rest of the data analysis and will conclude the results very soon. Thank you so much. That's it from my side.
Thank you so much, ma'am. I hope your presentation truly invites us to take on clinical applications of the PEMF therapy. And now, ladies and gentlemen, the moment that many of us have been eagerly waiting. It gives me immense pleasure to invite Mr. Alexei Erefev, Commercial Director of Elamed Russia, to take the center stage to unveil the grand polymath device that has come to our institution from Russia. It is a state-of-art pulsed electromagnetic energy field system therapy. Mr. Erkevev, we warmly invite you to unveil this remarkable piece of medical innovation. I would also invite our distinguished delegates from Russia to please come to the center stage for the device.
Так, дорогие друзья, я рад, что наш флагман Полимак наконец-то появился у вас.
My dear friends, Alexei is very glad that our flagman device Polymark is already in Amity University.
Я надеюсь, что работа, которую вы будете на нем проводить, принесет вам удовольствие и те плоды, которые вам будут необходимы.
He believes that researches and clinical studies made on Polymark device will have a positive feedback and a future development of Indian and the world medicine.
Далее я, наверное, слово передаю Ольге Бурдасовой для проведения уже мастер-класса по использованию этого аппарата.
And right now we would like to ask our colleague Dr. Olga Burdasova to come and to say a few words about Polymark device and maybe basic masterclass for this Polymark device.
We now invite Dr. Olga to continue with a detailed presentation on the Polymag, walking us through its clinical application, unique features, and the evidence supporting its use.
Thank you. Thank you, dear colleagues. I have a little presentation, but I decided not to present using screen because it is more important to present using the device. And that's why we will discuss this device touch by touch, yes? But before this, I want to say warm words to Mr. Dr. Sethi, and I visit Amity University for the third I think third, maybe fourth time. Yes, fourth time. And we value your impact to the development of physiotherapy and PMF therapy. Thank you very much. And my colleague, Dr. Alexey Ivanov, wrote a book. We discussed this book with you about the pathophysiological processes in tissues under the influence of PMF. This is only the start, the first version of this book. We will work in future about this information, and can I invite Dr. Ivanov to give this book for Dr. Professor Seti and for our colleague, Dr. Katrin. You will give it to him. He signed this for you. Thank you very much. Thank you very much. Thank you, colleagues. Congratulations for our medical director, Dr. Alexey Ivanov, because he was he is the driver of PMF therapy in Russian Federation, because he is always in connection with all our main scientific centers in Russian Federation. He knows all opinion leaders, top leaders in our country, and always communicate with them. So, and just now, let's discuss this device. Should I use microphone, or maybe I have a good voice? Not only my health, so I will speak microphone. Dear colleagues, this device is not portable device. This is device registered as a medical device, especially for clinics, for universities, for big scientific centers. Why? Because the main feature of this device is the opportunity to work with different parameters of low intensity. Switch on. We have a big range of opportunities using polymer. When we discussed portable devices, I told you that LMAC02 has 79 pre-installed programs. Very good, yes? 4 programs, pre-installed programs, has Diamag, for example. There are 1,345 pre-installed programs in Polymark. It is a very big amount. In our country, they are linked to our classification of diseases, number 10, but we use 10 classification of diseases in Russian Federation. In India, you use 11. That's why we changed our manual, and you have such a manual, to be easy to use in your own practice. We can't follow 10 classification of diseases, but we can use it following numbers. Program 1, Program 2, Program 3, and so on. More than 100 programs. How many diseases we have? Not 100. Why we have so many programs? Because we have different stages of our diseases. For example, with edema, without edema, acute period, subacute period, chronic period. That's why when we use manual and we are looking at our diagnosis, we should choose not only their problem, but their stage of this problem. And it will be, for example, A point 15, 1, 8.15, 2. First stage, second stage, and so on. We try to make this manual good for use for our Indian colleagues, because manual in our country is nearly the same, but for our classification. All these programs are pre-installed, but there is an opportunity to change parameters. We know frequency, we know intensity and time, the main three parameters of this device. We can change only intensity and only time. The intensity can be changed from 1 millitesla till 45 millitesla. The time can be changed from 5 minutes to 20 minutes. The first step of intensity is 2 plus 2. 2, 4, 6, 8, so on. After 10, plus 5. 10, 15, 20, 25, and so on. Why we need this function? Because sometimes we have different types of patients. For example, adult, or maybe baby, 6 months. And we understand that the parameters of influence should be changed. There are some programs, for example, for children in this manual, and main points how to use it for children. But we know that, for example, for babies, we can use PEMF only nearly 4 till 6 millitesla, not higher, not higher. So we should sometimes change this parameter. For example, the main parameters for this program is 15 millitesla. I need to treat a baby. I should change the parameters, decrease the intensity. The time, the same situation. For example, when we have very old person or maybe exhausted person, we need to change the parameter of intensity and the parameter of time. We can't change frequency. Why? Because some pathological processes are depending on frequency. For example, when we use frequency nearly 7 millitesla, it is good for blood circulation, respiration, metabolic process, activation metabolic process. But when we use 15 or 100 Hz, it is anti-analgesic, anti-inflammation. And if we deal with pathology with inflammation, we need higher frequency. And these parameters are pre-installed and we can't change these parameters. But you're a great university. You have scientific base. You should think about different situations and you have an opportunity to change parameters. For example, as about transcranial magnetic stimulation, I visited a last neurological congress. I'm a neurologist. My first specialization is neurology. In Russian Federation, it is called veins reading in our country, the biggest neurological congress. When we work using frequency 7 millitesla, we influence the blood circulation, brain blood circulation, and the main point of our work is vessel. When we use frequency 100, the main point is not vessel, but microglia, the tissue of brain, microglia. And there was a great discussion about the Parkinson's disease and Alzheimer that are not vessel problems. They can be combined. For example, classical Parkinson plus vessel Parkinson. Yes? And everybody wants to treat Parkinson, and we have no treatment. It is rather hard to do. But, for example, you can compare just now the influence of 7 millitesla with 7 Hertz, 7 Hertz and 100 Hertz, because 7 Hertz is for vessels, 100 is for microglia. And you can compare when we deal with not dementia, but cognitive deficit. Cognitive deficit. This program is in Polymark. This program is in Polymark when used transcranial band around their head. So I think that this opportunity to change parameters is very good for university, for clinical studies, and we wish you to have many opportunities to make different clinical situation comparison, different comparison, and so on, using Polymark device. And now the main information about Polymark. You can see the device. It is very easy to move. Why? Because sometimes our patients are not mobile. And sometimes we need to go with this device to our patient in clinics. It's easy to put this device to electricity, no problems, in all our departments. For example, in neurological departments, no problems. At the same time, we can treat 2 patients simultaneously. We have 2 patients on display, and we can treat 2 patients simultaneously. It is good. It is a commercial part of Polymark because we have the big amount of our patients per day. Yes? We have different types of emitters. There are 4 main emitters. Main emitters can be used like MET, or it can be used like solenoid. There are big solenoid. After fracture, after different injuries, wounds, and so on. It is easy to store because the square is little. Yes? Your university is very big, but sometimes we have a little square to put this device. Main emitters produce low intensity, low frequency pulsed electromagnetic field. Different types. The first type is constant time. It means that at the same time, all the emitters give us pulses. At the same time, all emitters. This type of work is good for acute period, as usual. But you should follow manual because it is very serious work to have a parameters, to understand the parameters. But as usual, it is for acute period. Then we have different types of traveling PEMF, traveling or running PEMF. What is it? It means that emitters work step by step. 1, 2, 3, 4. They are running vertically, horizontally, or diagonally. Why we need this mode? Because when we have traveling PEMF, you know that PEMF change the charge on the membrane of our cells and try to make our cells and big molecules move. It is the imitation of moving. So we have good blood flowing and good lymphodrainage effect. You should follow manual, of course, and use different types of traveling PEMF. When we can use big emitters, when we have big surfaces, for example, back, legs, and so on. Very good. We can even less the intensity and use for whole organism. It will not be immunomodulation, great immunomodulation situation, because the lower point is 1 millitesla, and we need for immunomodulation lower parameters. But it is rather good when we have exhausted people, for example, because they have no side effects after using very low parameters. And other situations, for example, when we have traumas and osteochondrosis and so on. The next type of emitters is line emitters. It is easy to understand that we can use these emitters, for example, for long surfaces, nerves, vessels, and so two types of magnetic fields constantly, all emitters at the same time, or running PEMF. When we need running PEMF, when we need the situation of the work of emitters at the same time, when we have edema, for example, acute edema, to stop the progressive of edema. When we need traveling PEMF, we need it to make the dynamic of flowing, blood flowing, conductivity, for example, when we treat nerves problems and so on. That's why we have different situations to treat using line emitter. In one program, we can use different types of emitters. You will see it on the screen. For example, when we have problems with scapular periarthritis, we can use, for example, local emitter and main emitter. You can see the picture and how to use. You will understand it. All emitters should be put on to the main part of the device to work correct. If there is not connection, the device will not work. The next emitter is ophthalmological emitter. We will put it on these things and we can treat different problems with our eyes and locally for eyes, locally for ears, locally for mandibular, for example. Yes, for mandibular, for joints. For joints. Also for neurology, yes, for forms. We have good results about the treatment of blood circulation problems of the I forgot this word. You understand me, yes? But now we have a clinical research about the optic nerve. You know that treatment of optic nerve is a very hard problem. Maybe we will have good results in this situation, and I think that it will be a great decision in the physiotherapy. Maybe, we don't know. But just now, the results are rather good. It's good, yes? The next emitters are local emitters. Local emitters are rather big. And when I discussed LMAC02, I told you that the penetration of PEMF depends on emitter. It is treatment penetration because PEMF penetrates through a very big distance. But treatment penetration for these emitters is 8 centimeters. For these emitters is 15 centimeters. So it can penetrate deep into tissue. For example, internal organs. For example, big joints and some other problems. Sometimes these emitters are used when we have different skin problems associated with edema and allergic situations and so on. This emitter. And the next is transcranial emitter. Absolutely the same like DIAMAC has, but absolutely the same. And indications are the same, but the parameters are not the same. There are parameters like DIAMAC has, but some parameters are differ in frequency, for example. Yes? I told you about microglia and inflammation in microglia. Why? I told you, I begin to speak about microglia. When I visited Neurological Congress, many discussions were devoted to microglia inflammation because it is the predictor of cognitive deficit, and this is the predictor of Alzheimer and Parkinson disease. So, changing parameters, we can influence not only vessels, but glia and hypothalamus zone. Some doctors asked, do you have clinical study about the changing of the level of dopamine, serotonin, melatonin when we use DMR? No, because I can't have a part of tissue from hypothalamus at all. and it is very hard to have laboratory information following it. But we have clinical symptoms, and we follow to clinical symptoms where doctors we know the pathophysiological processes that influence this zone. So, changing parameters, we can influence microglia, hypothalamic zone, vessels, and cortical exorting. I forgot this word. Just a minute. Возбуждение коры. Just a minute. Using transcranial PEMF, we can change the parameters of rhythm, alpha, beta, theta, and we synchronize this rhythm so we can treat sleep disorders, for example, and sometimes of other disorders, for example, sometimes of depression, and so on. So, using polymark, you have all types of opportunities to influence to the head, to the body, and all our tissues and organs. That's why we have so many indications for this polymark. It is very good to use because we can treat two patients simultaneously. But what has happened when we treat our patient using polymark? What usually they feel? They feel nothing. And it is not good because I'm a doctor and all our patients want to feel stretching, heating, and so on. It doesn't matter. something. In this way, the combination with electrostimulation is very good because electrostimulation and PEMF is a very good combination. Muscles, vessels. We feel we have a good clinical effect. Maybe it is our future. We'll try to work in this way. It will be good. Maybe simultaneously, electrostimulation and PEMF. It will be a very, very good devices because it is the clinical effect will be higher. But polymark can be used with electrotherapy in your hospital. You have electrostimulation. Very good. Let's do it. But our patients feel nothing when we use polymark, and we should give our patient the information why we can't feel PEMF, because the all process following after PEMF influence are deep in our tissues, in our cells, in our cell membranes, and deep in tissue. Yes. What are the main indications that is more interesting to use following to clinical effects, for example? Yes, because we want to treat everything, and our patients want to treat everything, using everything like a fairy tale drug. Yes, but this device is very good to deal with pain, different kind of pain. For example, back pain, joint pain. And it is good to deal with degenerative processes because PEMF influence different types of agents. For example, decrease the level of metalloproteinases that are damages factors when we have the cartilage degradation. So, I told you about our clinical study. When we use low-intensity PEMF, we prevent the further degeneration of tissue. We want to live a very long period of time. We need to prevent degeneration. PEMF is good in this situation. When it is not good, it is not good maybe when we want to have effect just now, using only once our device. When we have acute pain, maybe even ultrasound or electrotherapy will be better. But it is not the decision of the problem. It is the decision of the symptom. We need the decision of the problem. So back pain, degeneration, cognitive impairment. It is really a problem. Yes, just now it's really a problem. We can deal with this situation. After stroke rehabilitation, ischemic stroke, we have the window of therapeutic opportunities. It is 1 year. We know it. So that's why we need to have 3 courses of transcranial PMF during the first year after the ischemic stroke of our patient. Next situation, different types of metabolic neuropathies. We have different evidence. You understand that what is, for example, metabolic diabetic polyneuropathy. It is the problem with microcirculation. No decision how to put our erythrocytes through the vessel. No sensitivity, wounds, infection, high level of glucose, and we need to improve the situation. And there are no drugs to improve microcirculation because all drugs influence only vessels with muscle cells. Maybe one, but they need it. And it is very hard to open microcirculation vessels. And even we have a zone between cartilage and bone. It is very hard to influence it. It is very hard to influence the synovial fluid. What we do as usual? We put synthetic synovial fluid into our joint, yes? It's a good decision sometimes, but it's better when we have our own synovial fluid. PEMF approved increase the quality and the quantity of synovial fluid. It's good. Then next situation. Next situation is fractures, of course. When we have a long period of restoration after fractures and other injuries, we need to treat this person. We use different types of drugs and so on. We need Polymark to make this process quicker. Very good. Then maybe maybe this clinical situation are the best to have a visible result. All other situations are described in manual. Colleagues, there are too many different diagnoses. They are registered, but you should understand that the effectiveness of different types, for different types of diagnosis is different too. I told you about good effectiveness. There are diseases that are not very effective to use. For example, Parkinson. We wanted to have a good clinical effect influence Parkinson disease. It's a great problem just now, but we initiated the clinical study about Parkinson and the results were not very good. We have registration about Parkinson. You can use, because you influence not only tissue, you influence vessels, and the Parkinson symptoms associated with vessels problem is good. We decrease the situation with tremor and other symptoms, but for a very short period of time. It is decision for a very short period of time. The effectiveness is so-so. Can we treat? Yes, we can, if we need. Because we need to treat our patient. We should give them all the opportunity. We should have a holistic approach. We should use drugs, the first line of therapy, and we should use the second line of therapy. It is physiotherapy. And you know that some patients, for example, patients with migraine use too many drugs, NSAIDs, triptane, and other groups of without a good effect sometimes. And we need to decrease the amount of drugs. So we should use PEMF, and PEMF is a great help for our clinical practice. And I think that Polymark will be very good. It will be your friend in this. And some words about the screen. You remember I have a presentation, yes? A presentation, different types of emitters, and so on. This is screen. You can see the number of patients. The opportunity to work with 2 patients simultaneously. Then we should choose the number of patients. Patient 1, exposure program. You can see all the parameters. If you need, there is a function how to change parameters, time and intensity. Then you can see the picture and the amount of emitters you should use. For example, one local emitters or one main emitters or one local, one main, one line, one main emitter, and so on. The picture how to use and the diagnosis. The diagnosis is similar in all countries. We understand, yes? If it is osteochondrosis, it is degenerative process in back, it is dorsal gear and so on, but we understand what is it. You see the diagnosis. You can understand what you treat. So, if you need to switch on the second patient, you should choose patient 2 and you will have picture for second patient. And after this, simultaneously, you will have 2 windows, patient 1, patient 2, and the amount of time decrease. After period of time, you need automatically stopped, the production of PEMF automatically stopped, and that's all. What about the course of procedures? The course of procedures is usually 10 procedures because we work in clinics and it's easy to have 10 procedures, but it is not correct. Sometimes we need 20 procedures, depends on disease. Sometimes we can use maybe 5 times only. We can use it every day, after 1 day, 3, as in your clinical study, 3 times a week, for example. Yes, you can. We can use it for a long period of time or maybe a little shorter. It depends on our mind and it depends on our decision, but not very little period of time because the clinical effect we can see is only on the 3rd, 4th procedure, not earlier. That's why the course can't be less than 5 procedures. Better 10, better 15, better 20, depends on the patient. Depends on the patient. Once a day, as usual, 20 or 15, sometimes minutes, some programs 30 minutes, depends on diseases and so on. So these are the main opportunities of this device, main characteristic. If you have any questions, let's discuss without any presentation. Session of courses. Session of courses. One session, one procedure a day, every day. A gap should be not less than 8 hours. For example, in the evening, you can make the next procedure in the morning. For polymark, when we follow manual, it is only once a day. Why? Because we have patient once a day in our clinics. But if you have an opportunity, you can have 2 procedures a day. Between procedures, 8 hours. 8 hours. Or when we have such situation. For example, to reduce edema, to reduce pain, sometimes when we need to have a little period of time of procedure. For example, 5 minutes in the morning for children, for kids, and 5 minutes in the evening. Yes. So twice a day, but not 3 times a day. Not 3 times a day. And not for 2 diagnoses. For example, I have problems with joint and problems with back, not 2 zones. When we have a course of procedure, 10 or 12, 20 procedures, then we should have a break. A break is because of как этот эффект? Последействие. Post-treatment effect. There is post-treatment effect because we influence vessels. Yes, we have post-treatment effect. We recharge erythrocytes. The normal level of erythrocyte is 70 milliampere. Yes. When we have problems, when we have lower quantity of liquid and we are ill and we had fever and so on, the charge of our cells decreased nearly 30, 40 milliampere. I don't know how to say milliampere. Yes, and we should recharge. PEMF helps us to recharge, to increase the charge of our cells. And erythrocyte live 60 days, from 60 to 90 days. Yes, we need period of break, 2 months. 2 months between one diagnosis. For example, back pain, 2 months. Sometimes 1 month in critical situations. But if we need to treat different types of problems, for example, shoulder and maybe leg, we should have a break between procedures, 2 weeks. Shoulder, 2 weeks break, next zone.
And also, this is a electromagnetic device. It is emitting electromagnetic field. So does it interfere the devices sitting around it, or is there any recommendation that other electrical devices should be at a distance of 2 meter, 1 meter? I'm asking because you just said it can be used in combination with stimulation, because a stimulator is another electronic device. If we are using in combination, we have to keep that machine near to it. So does it permit that?
Yes, we have such recommendation. For example, this device is not recommended to use in when we have intensive therapy department, intensity therapy department, when we have different types of monitors and so on. That's why we had the clinical study in Kazan Medical University at the acute period of ischemic stroke, and they decided this problem, but neurologists and anesthesiologists were near their patient. Sometimes there is a problem for influence on this device.
So muscle stimulator is we are stimulating the patient.
Cardio pacemaker
Stimulator in the periphery. At the same time, this machine is used.
We can use.
So can it be done or NEMS?
Electromuscle stimulator. We can combine it.
So I'm saying, so when we are using that machine, and that should be in the combination, that equipment should be kept near it. So does it interfere with the functioning of that?
It's not a problem. You need 1 meter. You need 1 meter between devices, for example. If you need to use both devices for this patient, you should use, for example, electrostimulation and after it, PEMF.
Not simultaneously.
In some situation, you can use simultaneously. I told you that it is the future of the development of these devices, simultaneously use of electrostimulation and PEMF. But just now, we have no such combined devices. Maybe in future with specific parameters we will have. But just now, as usual, step by step.
And suppose by chance, by mistake, somebody gives an overdose to some patient, what can happen?
Overdose? It's very hard to have overdose.
And what to do?
Yeah, I understood. It is very hard to have overdose because we use low intensity parameters, not more than 45 millitest. And when we have overdose, it is as usual for patients who has a very high sensitivity for PEMF. They can feel the common symptoms. Maybe vertigo, maybe the decrease of blood pressure, headache, and so on. We need nothing to stop it, only to stop the procedure and to lie. And after 2-3 hours, all symptoms will be eliminated.
Yeah, okay.
No.
Ma'am, on
Tea masala is very good, I think. Masala tea. Chai.
Okay. So we can have tea after that.
Yes.
So one good reason to have tea. Ma'am, I'm just asking because on your slide, you are using this for tuberculosis fibrosis of lung. Right? This condition is tuberculosis fibrosis of the lung. I mean lung fibrosis. tuberculous fibrosis of lung.
The
So what is the aim? I mean, why we are giving when the lung is fibrosed? So why we are giving PEMF? What is the aim? I mean, we are expecting some regeneration of the lung in that case. Or why we are giving? I mean,
why we, look, I told
I
you.
hope you understand my question.
I told you that sometimes we have problems that we can decide, and sometimes we have problems we can't decide. This is fibrosis is the problem that we can't decide using PEMF, because fibrosis is very it's very hard to treat.
Hardened,
Yes, it's
lost
very
its permeability, membrane is gone.
yes, it's very hard to treat. But for example, after pneumonia, we have only problems with vessels. We have no fibrosis. Just now, we need to restore the potential of PEMF is good. When we have even fibrosis, PEMF is not good, but we can treat using PEMF because microcirculation is in our lungs, and the amount of vessels we have the little amount of vessels, we should influence this situation, and the capacity of lungs will decrease or will increase, but we will not decide the problem with fibrosis.
Fibrosis will remain the same, but whatever fibrosis will not revert.
No,
Right.
not.
Whatever vasculature, whatever the perfusion is there, we are just trying to exploit that. I mean,
Yes.
We cannot treat fibrosis, but with PMF, we can increase the blood flow.
Yes, of course. That's why you should know the pathophysiological mechanism of influence of PMF. So why I present Dr. Ivanov's book? Because he work with the main mechanism of PMF, and you saw main mechanism in the presentation of our colleagues, how PMF influence different tissues. But we can work deeper and deeper to understand this situation. And we are doctors, we should understand, and we should compare what result we want to have. Will it be good, or it may be not very good? Как не навреди? We should not do harm. It's the situation.
I mean, I put it another way. Suppose the same patient, when you are taking this patient for the treatment, what will you tell the patient? I mean, why I am going to take you for the treatment? So you can think it like that.
For this patient, I'll say that I'll give you a support. I'll give you a support of your breath, of your function of your lungs. I can't eliminate fibrosis, but you need to have oxygenation. Oxygenation. Why? If a patient is very clever, maybe it is doctor, you can give him information that we break the Rolex effect. We change the erythrocyte clusters. We make the surface of our blood cells bigger. The amount of oxygen is bigger. The oxygenation is bigger. That's why we need to improve the microcirculation in your lungs, because they are damaged, and they are damaged dramatically. They are damaged. We should be honest with our patient. Let's be honest, and let's understand that in this situation it is good, in this situation it is not very good, but we can treat. And in situation when it is not very good, bad, we can't treat using PMF. There are some diagnoses, 1,300 diagnoses. It is a very big amount, and a half of this is not can't give us radical effect, only support for some position, only support. But 500 is good. That's a big amount. So, colleagues, thank you for your time, for your day, for your interest to PMF. we hope that Polymark will be your scientific baby in your university and give you a new vision for PEMF therapy. And you can write your questions or maybe your decisions, your opinion, your vision, and so on to our Indian colleagues. Somendu Chatterjee is our medical manager. He knows everything. We are in connection. Gautam Sharma is our manager. We are in connection. So that's why, if you have any questions, please. Thank you. Thank you, colleagues.
Thank you once again, Dr. Bodasova. Let's have a huge round of applause for the amazing presentation. I would now like to conclude this session with a vote of thanks by Dr. Ankita.
Yes, yes. This. Yeah, please, please do it. Respected dignitaries, esteemed speakers, faculty members, delegates, and all the guests. As we come to close this CME and the training workshop on PEMF technology, this is my privilege to propose the vote of thanks on behalf of Amity Institute of Health Allied Sciences, Department of Physiotherapy. First and foremost, I express my sincere gratitude to our Vice Chancellor, Professor Dr. Balwinder Shukla, AUUP, Additional Pro Vice Chancellor Dr. S.K. Khatri, and Dean Academics for their encouragement and support towards this meaningful academic initiative. I further on extend my heartfelt thanks to Professor Dr. B.C. Das Sir, Dean Health and Allied Sciences, and Professor Dr. Jasubanta Sethi Sir for their constant guidance, leadership, and vision in making this program possible. We are deeply grateful to our collaborators from NUAGE Health Devices and Ilamed for this important academic event. A special thanks to Mr. Gautam Sharma, CEO, NUAGE Health Devices Pvt Ltd, for his support and commitment towards bringing the evidence-based PMEF technology to our university. We also sincerely acknowledge and acknowledge the contributions of Mr. Sumendu Chatterjee, Marketing Head, NUAGE Health Devices Pvt Ltd, and Mr. Ashish Rawat for their valuable support in this organizing event. A special note of thanks and gratitude goes to the distinguished guests from Ilamed, Russia. We are honored by the presence of Mr. LSK Ivanov, Medical Director of Ilamed and the Vice President of National Association of Physical and Balloonotherapy Professions. Dr. Olga, you were fabulous in presenting your polymic devices to all the guests present here. Thank you so much for joining Amity once again. I would like to extend the thanks to Mr. LSK Arafev, Commercial Director Ilamed, and Ms. Zulia Zebulova, Head of International Projects Ilamed. Your valuable insights, scientific expertise, and international perspective have greatly enriched this workshop. We also extend our sincere thanks to Dr. Meena Makhija and Dr. Jayaprakash Jayavalu for sharing their valuable and clinical research experience with all of us. I would like to thank all of my faculty members who were there with us in organizing this particular event. A very special thanks to my co-organizers, Dr. Ritika and Dr. Ruchika Kadra, for making all the efforts, coordination, and enthusiasm for participation throughout the program. Your presence and active involvement have made this event a great success. Once again, thank you everyone for being a part of this important academic initiative. We look forward to many much such more collaborations in future. Thank you so much. Have a great evening.
Thank you so much, ma'am. I also would like to thank all our faculty, coordinators, and volunteers, along with our participants who stayed till the end and listened to all the interactive information that we had in the session. Your enthusiasm and engagement has made this event a resounding success. May the knowledge that we gain today translate into better patient outcomes and make this modality as the future of rehabilitation. We would now request you all to stand up for the national anthem as a closing event.
गणमन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे.
Ladies and gentlemen, please join us for a high tea outside with some refreshment. I hope this is an excellent opportunity to bring up your questions that you had during the sessions and interact with our delegates. Thank you so much. Have a nice day, everybody.